It's 6:30, so we'll get started. I don't know if you all know Heather or not. I think most of you probably do. But this is Heather Vance, and she's with Henry County Health Department, and she will be sharing with us tonight. Thank you.
Thank you. Well, I've got a handout for you. And I apologize, the print is very small, so I will read this to you guys. But you can at least take this home and have it as a reference.
Or you know what, if you send that to me, I can make it print in like 2 pages per slide or something, or 2 slides per page, and then it'd be bigger print. Like if you want to email it to me, I can do that, possibly if people want.
Sure. Okay, so like Pastor Boyd said, my name is Heather Vance, and I am an employee of the Henry County Health Department, and specifically I'm the RN clinical manager for home health and hospice for that program. So I'm here to talk about the services, all the different services of the Henry County Health Department. A lot of people are, you know, when they think of the health department, they think of restaurant inspections, immunizations, things like that, but there's so much more that we offer. The first thing I'm going to talk about is the community health services. One of their focuses is My Plate Nutrition and Physical Activity Education Program that's currently offered at the schools, Holgate Liberty Center and Patrick Henry. And then also there's the Not on Tobacco program. It's a tobacco cessation program for teens currently offered at Fort County Career Center. Emergency preparedness, planning, preparing, and responding to disasters affecting public health or the safety of Henry County citizens. So if there was a natural disaster or if there was an outbreak of an illness, we would respond to that and help to get that back under control. The Community Health Assessment and Improvement Planning is monitoring the health status of Henry County and working with partners to address community health issues. The next program is Environmental Health Services. They are the division that investigates animal bites. They go to the like tattoo and body art, piercing, those parlors to license and give them permits. Campgrounds, each park is inspected in an effort to maintain clean and safe environment as required by state rules. Food safety, they license and inspect every food operation located in Henry County. Indoor environment, they provide information relating to indoor air quality issues. Mosquitoes, bed bugs, and ticks information. Public health nuisances, investigation to ensure compliance with all applicable rules and regulations. School environments, they inspect the schools located in the county and ensure they have a safe, clean environment. Sewage treatment, evaluates and issues permits to install, repair water sewage treatment systems and septic systems. Smoking rules, they investigate complaints related to smoking in public buildings. Swimming pools and spas, they license and inspect public pools and spa operations. And the water systems, they evaluate and issue permits to install or testing of private water to make sure that is safe. The next program with the health department is Help Me Grow. Early intervention services are offered for children under the age of 3 with medical disabilities that may lead to a developmental delay. They have nurses that do home visiting services. For first-time parents, they receive parental education, information regarding development, bonding, and attachment. They serve Defiance, Henry, and Williams County. They have a car seat program. They do car seat checks for all residents, and they provide car seats to eligible clients. Breastfeeding. They have a lactation consultant to provide assistance with breastfeeding for residents in Henry County and help me grow parents, the visiting home program. Home health. That is the division I'm in. I have been with the home health and hospice program for almost 10 years. We coordinate home care with the physician. We are on call 24 hours, 7 days a week. There's always a nurse available for an emergency or question. We provide skilled nursing care for assessments, medication, education on chronic diseases like diabetes, congestive heart failure, wound care, just a variety of home health, home nursing care. We also offer physical, occupational, and speech therapies at home. We have home health aides that are trained to assist with personal hygiene needs and the daily living needs. And we have social work services to provide caregiver support and community resource referrals. Our hospice care. We are there to support the patient and family to meet the physical, psychosocial, spiritual, and bereavement needs. We focus on quality of life. It's patient-centered care plan and family-based program. Hospice services include patient care, physical, occupational, and speech therapies, home health aid services, spiritual support, and bereavement support. Hospice services we're providing at home. We also contract with some facilities in the area, specifically Henry County Hospital. If we have somebody that their symptoms are difficult to manage and they need inpatient care, we can transfer them to Henry County Hospital. Also, if the family would need respite care, we contract with the Lutheran Home, Country View Haven, Northcrest, Fairlawn, and Archbold, and then Henry County Hospital as well for like respite services. If the family needs just some time, it needs a break. Sometimes when you're caring for a loved one, it's difficult to also care for yourself. Public health nursing, they are the division that offers immunizations to all ages. BCMH is the Bureau for Children with Medical Handicaps. They link families or children with special health care needs to a network of quality providers and help families obtain payment for services their children need. TB screening, we do TB skin testing done by appointments, head lice checks, and blood pressure screenings. Reproductive health and wellness, they do physical examinations, including pelvic exams, pap smears, and breast exams. They talk about abstinence education. They offer birth control, condoms, free as needed. They offer the oral contraceptives, the depot injection, diaphragms, natural family planning instruction, condom instruction, IUDs, and vaginal rings and emergency contraception. They do STD testing and treatment for males and females, pregnancy testing, referral and counseling, level 1 infertility testing, education on ovulation timing, how to determine ovulation, temperature taking, having a partner gel sperm count, and keeping track of menses, and they also do IUD insertion and removal. And the last thing, it's not on your slides, but the vital statistics part of the health department, that is birth and death certificates, and I believe the death certificates go back as far as maybe 1909, I thought I was reading. So, any questions? Insurances, private insurance, Medicare, Medicaid will cover a good portion of these services. I know specifically with home health and hospice, we accept a lot of private insurances. Medicare, if you have traditional Medicare, you can cover home health 100%. Medicaid does as well. To be eligible for home health services, you need to be homebound, which means, it doesn't mean that you can't ever leave your home, but it means that it needs to be a taxing effort to leave your home and infrequent outings in order for Medicare to cover those services.
What services do you have that are, which of these services are free? Which ones do cost? Are any free?
We get grants from the state for specific programs. All the environmental services are going to be for charge. The Help Me Grow program, their services are covered usually through like Medicaid, and it's usually not out of pocket for any of their clients. Home health and hospice, we take what we get from insurance. We will not refuse anyone for inability to pay. And then, you know, if you have co-pays and things like that, we will not bill for those. We basically take what we get. Immunizations, there are some people that are eligible for free vaccines or low cost. They ask for a donation if you can afford that. But most insurances will cover those immunizations. Another thing I want to talk about is WIC, Women, Infants, and Children. That is for pregnant women, nursing women, and the infants. They provide formula, breastfeeding support, coupons for like baby food, diapers. And then for, I think they go up to the age of 3.
If you want like an exercise program, I was thinking of the sober sneakers, and what I've heard, I haven't tried. Do you have to have a doctor's permission?
For like home health physical therapy,
Either any of them.
because they can establish a home program for you, and yes, we would need like an order from the physician to start that. And we would get a referral, and then the physical therapist would come out and evaluate you and develop an exercise plan for you.
Now, under this Help Me Grow, it says here for children under the age of 3. Do they have anything for like a 4 to 5-year-old child?
Not that I'm aware of in Help Me Grow, but they may have something through BCNH. I can look into that. But if you have any questions, you could call the health department and find out, talk to someone in Help Me Grow. If they can't provide any services, they can at least give you information on someone that can. I have cards up here, brochures for home health and hospice, as well as the health department. So you guys can get the numbers from there.
What do you guys do with emergency preparedness?
We have trainings. I don't know if you guys remember, a few years back we did a training at Colgate School. We called it the Zombie Apocalypse. And it was basically to prepare for like a mass virus or illness. We made arrangements for people to come in for medication, which was Skittles. They were prepackaged. I mean, we went all out for that. And it was kind of like a trial run so that we could tell if there was any areas that we needed to tweak or any areas we needed to improve, see what worked well and what didn't work. And then we have Tracy Bush. He is works in the EOC building, which is the Emergency Operations Center, and he would coordinate emergency response for like natural disasters. But we do train for, you know, those things that may come up, to make sure we're prepared.
Do you have
Since they closed the dental clinic there, I know everybody's seems to be going to Brian.
Yes, that's where it moved.
They're not starting any other kind of program or anything.
Not with the dental, not the health department, no.
Why did they close that?
I'm not really sure. I think that it was just they were growing and they weren't able to manage the volume of patients that they started to get. They needed a bigger program, a bigger facility. We just couldn't house that in the health department.
It seems like they're kind of taking things away.
Yeah. Yeah, healthcare is changing, and we're definitely just trying to, go with that and still provide the needed services for Henry County residents.
What's the medical reserve corps? That's, it's,
It's probably, is that
it's
on
on the first page. The next to last thing there.
Training volunteers to assist the health department and boards emergency partners during emergency or natural disaster. I'm not really that familiar with that. It's probably something with the EOC, which is right next door to the health department, which they monitor the weather for us and put out alerts on the radio. So they're probably a group of people that are on standby that are trained for how to respond to the natural disasters.
Okay. The reason I ask is, but by looking at that, is there a group that's based in McClure? Is there a group that's based in Holgate? Is there a group that's based in Deschler that's actually prepared and ready to respond to their communities?
I don't think that there's a group in each town. I know that when we had our training for the zombie apocalypse, the location for those mass clinics would be at Holgate School. That is our designated area. They have kind of the best setup for managing large crowds and volume of people, and they have a nice kind of flow to their school, so everybody's kind of come into the gym and go out through the hallway, and it's just a really nice flow of things. But I don't think that there are groups located in each city.
Well, we have Lutheran Church for emergency storms and things like that, stores.
Oh, yeah.
But do they have any supplies at all? I mean, like if a tornado would actually hit?
Do we house any at the health department? No. I mean, we have medical supplies, but like water, food, things like that, we don't house any of
The
that.
way I understand that, that's a Red Cross thing.
Mhm.
And yes, we are the Red Cross shelter. We're not the storm shelter. St. Paul's is the storm shelter, like if we've got a tornado bearing down on us, they've got a little bit underground. We do not have that. What we are the place that is, say half the town lost the houses. We don't have that many cots up there, but we got enough cots and blankets and stuff to get started, and the Red Cross would bring in the rest. Who would we talk to with, or could you ask them to get a hold of me with the whoever's in charge with the medical reserve corps.
Sure.
Because I know we're planning something in September with the Lutheran Church, some emergency preparedness trainings.
Oh, sure, yeah,
And so we're interested, in all those kind of things to
absolutely.
try to be prepared for if something happens, that we can actually be of usefulness instead of hindrance.
Right.
Did someone take over for Gloria? Because I feel like she had something to do with that.
They did not fill that
Okay.
position.
Yeah, because it was Virginia and then it went to her with the Red Cross,
Well,
right?
I'm thinking, oh no, I was thinking for the medical reserve with the health department. I
Oh.
think Gloria Arps, when she was there, had something to do with that.
Yeah, she did a lot of our emergency preparedness trainings, but they don't have that position filled. I don't even know if that position is in existence anymore.
Well, I know how good the Henry County Home and Health is.
Mhm.
Yeah, thanks to you and Amber.
Yeah.
I don't know what I'd have did without it, because I sure wouldn't know how to take care of that wound back.
Yeah,
That was a
that's
wonderful service for us.
good. I'm glad, and I'm glad that he had a good outcome.
Yeah, yeah.
Mhm. Healed up nice.
Ohio is for my husband for his move back, but those things are something.
Yeah, they were.
I wish they would have got it on him about 2 weeks sooner.
Yeah. I'm
But
glad
once it was on, easy.
it did the trick, yeah. They're amazing little machines.
That's what they said, somebody was telling me, I was telling them about that, and they said, years ago, you just have to pack it, everything yourself.
Right.
I said, well, we're blessed now, because we
Yes.
just had the nurse come in.
Right, they made huge
Yeah.
advancements with wound care. There's a lot of different treatment options now for those non-healing wounds. Mhm.
What kind of water system testing and treatments and that kind of stuff do they do? Do you know? That,
Maybe
yeah,
like wells and pumps and things like that.
Yeah, I know, like, when we were building our house, they came out and tested like our well water and did like the site testing before the septic system in. But, I'm familiar with the types of things that they offer, but I don't know all the details for the environmental services.
I almost feel like that you can come in and get a kit or something from them too, and like test your faucet water if you want. Like you
Yep.
can get a sample and bring it to them and they'll test it for you and
Yeah.
things like that.
Yes.
is there a charge for that?
I think there is. I'm not sure what the cost is, but if you would be interested in doing that, you can call the health department, and John Lindsay is the head of the environmental department.
Could you say the number?
Yep, the health department phone number is 419-599-5545. And the home health and hospice phone number is 419-599-5612. And I've got some brochures up here that have that number on them. Any other questions?
Oh, this is usually talking to group.
There's pens, brochures, business cards up here. These are like sticky note cubes, so help yourself to whatever you want. Pens over there.
And cookies too, help yourself with cookies.
Well, thank you, Heather, and we
Um,
appreciate you coming out and sharing with us.
Sure.
Thank you very much.
You're welcome. Thanks for having me.